Okay, guys. First, I know that not all of you have turned in your questions yet, but I really needed to go ahead and get something recorded before I completely crapped out for the day. Also, I am not dying. I just don't have on makeup. So, don't start any rumors. I also still sound pretty bad, I know, so bear with me. Hopefully, it's going to be better by Wednesday when they remove some of the stuff. But anyway, until then, you guys get to hear super nasally. Sounds like she's going to die any moment, Dr. Varnado. All right, so also I have the slides up not because I'm going to go through them all, but mostly because I felt stupid to answer questions without y'all being able to see me, but I would prefer you see me in the little box at the bottom rather than full screen at the moment. All right, so Standard 7, I'm going to do a quick one of this, and then I'm going to look through the questions that people submit after I record this and decide whether I'm going to do a part 2 or not. But basically, this one is all about education and training and how we do that. And there were a couple of themes for the questions that have been submitted. There are a couple of these that you guys just seemed a little bit more sort of keyed in on than some of the others. And so I tried to organize them a little bit so that it sort of made sense in terms of how I was responding. So basically, let's see. There were sort of two questions about training. And basically, like most of the ethics code, this stuff is sort of common sense, or supposed to be. And that basically, if we're going to have a program, we need to design it well. And we need to do that competently. And a couple of the questions were sort of related to, all right, well, how do we do that? Keep in mind that APA releases a number of guidelines for all sorts of things, including for doctoral programs. For doctoral programs, they have a very clear guideline of the competencies that you are supposed to have to undertake, and how you're supposed to be trained in order to be a clinical, or what they're calling health services psychology now. It doesn't apply to things like IO, but there are organizations that are more IO related. I'm going to mess it up. It's like IPS. Anyway, Dr. Big knows. But they have guidelines for how to train, in terms of what they would accredit in IO psychology. They have standards for how we do this in undergraduate psychology. What they haven't had was the master's level, in terms of what we would have to do to accredit at the master's level. So what we've always done is actually modeled most of our courses after what would be the introductory work required for a doctoral level program. And one of the reasons, for example, I don't teach this as a psychotherapy techniques course anymore is because when they redid the last doctoral program requirements, they no longer required that. They required a course on ethics and professional considerations, so we shifted. We, though, kind of foolishly decided to wait and make it an official course until we reconfigured everything, thinking that the accreditation process would move a little faster for master's programs. But one person asked a question about, and it's partially related to standard 7.01 and partially regarding master's programs for accreditation in clinical psychology. If these programs were to become accredited, will there still be discrepancies in competence levels between those who did a master's versus a doctoral program? Yes. You're not getting at a master's level the same level and depth of training as you would get at a doctoral program. The way the standards are written, and the way, for example, Louisiana state law is writing it up, and every state's going to be a little different. But what you would not get is that advanced level training and assessment particularly. And so with a master's level, with the state law, what they've pushed for is you would be considered like a psychological associate. You could only do some forms of psychological testing, and it would be kind of on the level of what other master's level disciplines can do. So for example, you would have to, for example, you could do symptom inventories, but you could not do a neuropsych evaluation without supervision of a clinical psychologist or neuropsychologist. You could not do intellectual assessment, learning disability assessments, and things like that. So the training in looking at the master's versus doctoral level, and what we can kind of look at now, my thinking, and I think I told you guys this, is that it's probably going to be a little bit more on par to what the original PsyD training model was, which was, it was a bit more of a, like, think of it as like a 3-year program rather than a 2 years master's to get that clinical training. And it's going to focus more on therapy. So not as many classes on things like testing and test development. So you probably would still do a psychometry class, but not the in-depth classes that I had to do in terms of like measures design and administration of measures specifically. So you would not be able to do that independently. After that, the licensing board is dragging their feet. I actually got an email right before the break. They aren't delineating exactly what we have to do, but there's a focus on core classes. So it would still be the core stuff with the masters, but then some additional training in therapy, not as much in of the research requirements, not as much in terms of like the doctoral level dissertation type stuff, because in my training I had to do my thesis, but then also an intermediate project and a dissertation, so that gets cut out. And I had to do like 3 classes, I think, on assessment, and so that gets cut down to maybe 1, and it's more the therapy-related classes and the hands-on practicum. So the second part of that was relatedly, how can we, when applying to such programs, evaluate what they are doing, what they're designed to do, and other than by looking at student outcomes. That's going to be difficult for a bit, because for doctoral programs, what I tell people to look at is things like, did they pass the licensure exam, and what was more importantly, their placement on internships, because there's still going to be that internship requirement. That's one of the things that's going to have to get worked out. How do they do that? Like, do you have to do extended practice under an individual therapist out there, or are you going to actually have to get a practicum placement, or an internship placement? And so we're going to have to see how all this shakes out before there's those sort of independent metrics of how many students from this program pass the licensure exam, how many of them get an internship placement, and things like that. What you guys are going to have to do wherever you decide to practice is you're going to have to look at what the state law says and make sure that the program can clearly delineate how they meet those state requirements. Also, you should look at what APA is saying about accreditation at a master's programs, and you're going to have to independently evaluate, is this program meeting these competencies that they say we need? Hopefully there's going to be more of those metrics that'll come, but that's going to come with data, which we're not going to have until these are up and going for a little bit. There was another question about how can psychologists make sure their training programs ensure an understanding of ethical duties? That's a very broad question. And I'm not sure I have a better slide to have on in the background. I don't think there is. But basically, it goes back to supervision and adequate training, essentially. You have to start with what the guidelines say you're supposed to get in terms of ethics. And then you have to look at what is the program offering, not just in a class, but how do they handle it in terms of supervisory training. A lot of those ethical dilemmas that come up, you take a class like this, you read about it, it seems sort of simple. You're then going to confront it when you're actually in those settings where you're doing therapy, and new stuff comes up all the time. So at that point, it becomes about sort of this part where you have to make sure there's adequate faculty and supervisory staff to actually watch over what you're doing and have their sort of looking over your shoulder and making sure that your supervisor is addressing ethics and how you're supposed to sort of react to certain situations. So this part is that sort of what we're supposed to do is we have to keep our course descriptions up to date, where we explain, for example, what those field experiences are going to be. I think for you guys, if you're thinking about this master's option at some point, you're going to have to look at those field experiences, because that's where you're going to really sort of parse out what is a really good program and what's not. I personally don't like the model where we send students out into the community and you're supervised by people out there that I have no say-so over, because that could go really well or really bad. Basically, I think that, the doctoral model is usually that there is a clinic on the campus where the faculty are supervising the students in the clinic. If you are in a situation where they're sending you out there, it's not necessarily a bad thing, it's just how they do it. You have to make sure that they're not just going to send you to work with these people out there and your on faculty supervisor just isn't paying attention. Also, you ensure that by doing things like, and I really believe in this idea, you never just want to work with one person in your training. That's always been the thing that made me nervous about some of the online programs or the hybrid programs, is that those programs don't always ensure or help the students set up their practicum experience. And that's where you're going to learn almost everything. And so I have one of my former students who's now actually pretty big in LPA and the licensure board. You know, he worked with a neuropsychologist as an undergraduate. He also worked with them when he was doing his master's. And as far as I know, that's the only person who supervised him while he was doing his hybrid program. You want to get a wealth of training. You want to rotate through different people, because the idea is also that you're going to have folks who are better at one aspect of your training than others, and that making sure you're being trained by multiple people and there's that focus that all of them are trying to teach you those ethical duties and make sure you understand them is how you're going to sort of get that best training. But it really ultimately comes down to you need to know enough that you've got to look at the ethical code and understand it. And you want to make sure that the way they're doing their training and supervising those practical experiences, that you feel comfortable that they're going to adequately convey to you what your ethical duties are in a particular situation. And if you're not sure, ask questions. Let's see. What happens? Yeah, up to date. I think this is all accurate. So this is kind of a good question. What happens if you've taught material one way, but new empirically supported evidence is found during the same semester? Do you go back and reteach the material? Yeah. I mean, I think this, I am not, okay, I don't like telling people when I'm wrong, because the look on some students' faces is like just sort of like they lose all faith that I know anything. Like I mess up one thing, it's like, what good am I? That happens a lot. But basically, I've done this several times, I think, over the course of the semester. When I don't know the answer, I try to go find it. And sometimes, even when my knee-jerk reaction is, oh no, I know this, I still go double check myself. And that's what I think in a large capacity. And I'm not saying I'm very good at any of this. That's not, it's just the more you question and double check, the higher the probability you are that you're going to be good and you're going to present things accurately, and you're not just going to rely on that hubris of you think you know everything. So if I realize that there has been a shift or something has changed and I've already taught about it, I make a point of going back. I think that's a good life lesson, and it's a good way to sort of model this is how we're supposed to do things. We're not learning a set of facts that never change. Our profession is supposed to change over time, and sometimes we're not going to be up to date. And when we realize that, we take corrective steps. So there are times where I really want to email every student that I've ever taught and correct things, but that seems a bit excessive and probably overkill. So there is that. This one, yes. So this is just basically, and I had this one highlighted because it was one I was gonna make sure I talked about when I was moving fast. We want to make sure our syllabi are accurate, that they adequately convey what you're going to do in a class. But basically, you have to have flexibility. And some students will complain about the fact if you add an extra assignment, or if one of the biggest things I get complaints about is that I never get through all the material that I have on the syllabus. Students feel like if I don't read the textbook to them and get through the whole thing, that they're not learning. And I think some of the best things that people can learn are actually on those side conversations that I don't know how to write an essay question for. But basically, we do have to modify it sometimes if for whatever reason that might be. So we basically, if we do modify it, though, ethically and pedagogically, anyway, I think it's even a university standard. If I change the syllabus in some substantial capacity, then I'm supposed to do something to make sure that everyone is notified of what those changes are. So that's why my syllabus reads a little bit like a legal document and a little bit like a horoscope. So I have some flexibility. Right, not that one yet. So there's another one. Well, actually, I'll go ahead and do this one. I had a little bit out of order, but I was doing it from memory. I had two of you guys ask about this, and then I had a couple people ask about multiple relations, and another ask about supervision. So I'll talk about this, because this one you guys had some interesting and in-depth questions about. So psychologists do not require students or supervisees to disclose personal information in course or program-related activities, either orally or in writing, regarding sexual history, history of abuse and neglect, psychological treatment, and relationships with parents, peers, spouses, or significant others, except if, 1, the program or training facility has clearly identified this requirement in its admissions and program materials, or 2, the information is necessary to evaluate or obtain assistance for students whose personal problems could reasonably be judged to be preventing them from performing their training or professionally related activities in a competent manner or posing a threat to students or others. All right. This is one that I think the original intention of the standard has shifted a bit. And you guys thought of it as more of a, well, you guys thought of it a little differently. My read of this one has always been that this is more for graduate level stuff. Because if you notice, is that program or training facility has clearly identified the requirement in its admissions and program materials, meaning you would have to apply to the program. And so I don't know why somebody would ask you those things. This sort of basically violates all sorts of like icky stuff, right? That being said, there are some programs that, for example, let me show you this one. This one. So this doesn't apply to postdoctoral programs, so like a postdoc, because one of the things that psychoanalytic programs make you do is you have to go through psychoanalysis to become a psychoanalyst. And in DALI, that's usually a postdoctoral sort of thing. Raises all kinds of weird ethical questions. Like, because you're basically like your instructor is your analyst, and that's a problem. And this would basically indicate that in addition to sometimes there are these programs that are requiring therapy, sometimes programs may also want to know these things as part of their evaluation process. And so think of it as more, and I think of this one as more like they might evaluate these things in terms of admission. So I'm going to tell you guys basically straight up, and I usually give this advice when you're applying to graduate programs, do not put personal information that you don't want strangers to know in your application process. When you put it out there, leaves you open for them to ask you questions, and it's fair game. And I actually got in trouble for that. There was a person who applied to work, not trouble. The other grad students thought I was horrible, but y'all can make your own jokes about that. There was a student who basically included in her admission application that she had a long history of eating disorder. Of an eating disorder. She really wanted to work with eating disorder patients. And in fact, she had somewhat recently been released from an eating disorder treatment program. There are some patients I have worked with. There was a therapist I worked with, not this particular person, but who was very vocal about their own experience and history with an eating disorder. A lot of my patients thought that they gave her some edge. And they actually in the hospital would prefer to work with her because they thought she would understand better what they were going through. When this person was applying to our graduate program, we were doing this little group interview thing with the graduate students. And when it was my turn, I asked her, one of the most important components of a cognitive behavioral treatment for eating disorders is being able to model appropriate behavior and appropriate reactions to certain things. And was she far enough in her recovery that she felt that she would be able to do that when, for example, eating a meal in our group, which we were required to do. At which point everybody else, like, jaw dropped, stared at me. She put it in her application. We did not ask. So I would question why anyone would ask this stuff, other than if they were in a treatment program where basically your personal history might impact your ability to do this. The other part would be if you're in a graduate program, and again, this is how I think about this. If you're in one of my practicum students, and I'm starting to really get concerned about the fact that you seem to not be doing well psychologically, at that point, my license is on the line. And at that point, I can basically, you have to tell me what's going on, because I have to make a decision about what is safe and what is going to keep those people you're working with safe. And so for me, that's what this is about. Now, that being said, I also have some colleagues when they got out of graduate school that they started doing these behavioral classes where you would do like some behavioral modification, and that always made me very queasy, because when is it an education and when are you doing therapy? And remember that multiple relationships thing. So I'm going to say approach all of this with caution. And I don't think it would apply to a high school class. In fact, I would question why someone would do this with a high school class. Because someone brought up there's a bunch of legal ramifications of if this is, with some of our students, if they disclose certain things in the classroom, it's not just in high school. I have to basically disclose for Title IX. Excuse me. Sorry, I had to sneeze, and I have to do it with my mouth open, and I really didn't want you to see that. All right. Anyway, so there are legal ramifications when you're asking people to do this. And so I'm going to say that, you can't do it unless you warn people ahead of time. And this really talks about, like, you've clearly, like, sort of identified that the program or training facility has identified that you have to do this. So you're willingly putting it in there when you're applying. And then after that, this part becomes to keep other people safe. So, I high school classes, personal problems, that crosses, don't overinterpret this, because then we're talking about lots of multiple relationships, you doing evaluations for people who aren't actually your patients, and it's a whole ethical quagmire. And someone asked about, like, what do you do if someone's personal issues might impact their clinical ability? I have to figure out, as a supervisor, are they able to do their job and keep those people safe? If not, think about the licensure and what I would have to do if I suspected one of my colleagues. With a student in training, you have an extra level of responsibility, because think of it this way: when you're the licensed person supervising, it is your license on the line. You are responsible for what they do. And so my other with this is, if your supervisor says do this, unless it is unethical or illegal, you probably need to go with them, because you're risking their license. And that is not something you need to be flippant about. It is not something you need to get like you know better. And if you think that they're wrong, you need to argue your point and listen. Because at that point, you're really assuming you know a lot more than someone who's been doing this for a long time. And I'm saying that because I had a student do that at some point when I was supervising practicum. And it was pretty serious. So, but yes, if something is going on with you that's impacting your ability to work with the public competently and in a safe manner, then we have to take steps. And what you would do would depend on how the level of the impact and impairment. So I also, sort of relatedly, if a psychologist supervises someone who constantly struggles with handling the same types of scenarios in therapy sessions, like active listening or giving clear feedback, should you point this out every time in order to ensure they are practicing in an adequate manner, performing good techniques, or should you let it slide at times? Yeah, no, don't let it slide. Again, you got to balance. Am I being an asshole and micromanaging, or, honestly, why are you not doing what I'm asking you to do? And I think that as a supervisor, you have to balance that. Maybe, you don't start with just sort of ripping someone's head off, but you do need to figure out what the hell is going on. Why is this not happening? And I'll go ahead and tell you guys the story. when we were able to put folks over in the counseling center, I was supervising a student, and she came in and she was talking about, she had a patient that basically had come into college as a teetotaler, never drank, did drugs, anything. She suddenly was spending all day, every day, smoking pot in her room. And the student didn't think that was a big deal, that, it was just a little pot. And so when I would sort of protest, no, this is a big deal, she then kind of sassily pointed out that I was a cigarette smoker. And yes, I was. It was horrible. It was also legal, and I was of age. And so potato, at that point, smoking pot was completely illegal. And it seemed a bit concerning that someone would supposedly go from not touching the stuff at all to not doing anything but smoking 24 hours a day. And so this became an ongoing battle of wits, where at some point, to try to prove a point, I told the student that I wanted her to add, if it was really not a big deal, that the student that she was treating should be able to withstand and not toke for 48 hours. Just go 2 days without smoking. So came back for the next supervision. I didn't talk to her about that. Okay, you're going to do that this time, right? Yeah. Came back again. Nah, I don't think it's necessary. At which point I lost my shit. And basically it became if you want to continue in this practicum and you want to continue working with patients, I want to point out you're past the last date to withdraw. You will do as I direct you, or I will remove you from the practicum facility. Do you understand? And she copped an attitude, and I didn't give a shit. Because at some point, she's basically saying that after 2 months of working with patients that she knew more than I did. So, no, you don't let it slide. No, I'm not going to destroy somebody just because they're having trouble. That becomes a constructive conversation. But I'm going to go back to, if something is just repeatedly not going right, what's the end result if you just kind of let it slide? You're going to send them out, and they're going to keep doing it. And so I'm going to tell you guys that you working with patients is an awesome responsibility that you should never forget is an awesome responsibility. And I learned a lot of what not to do from those people who supervise me, but you also can't outright dismiss what they're telling you to do. And if it's a skills deficit, you work with the person. If it's obstinate, you treat it as such. So, sorry. I know that was a little harsh, but I'm still pissed off about it. Way longer than I should have been, because that was a long time ago. It would be unethical to not address a skills deficit. And again, your reaction has to be based on the level of the skills deficit. If it's just a style thing, it's not something I like, but it's a valid therapeutic thing, then that's not what we're talking about here. But if they're actively not doing something they should be doing, or they're doing something wrong, it would be unethical of you to not address it. Okay, I'm going to acknowledge that I backed up a little bit because I was angry thinking about all that again, and I said something I shouldn't have, so I'm hoping I edited it out. All right, so the last couple were about multiple relationships, I think. Yep. All right. So, let's go ahead and talk about this one. Yeah, this is just sort of what I had said before. We do have to, though, to finish up a little bit, you do have to basically tell people, like, this is how you're going to be evaluated, and these are the expectations, especially when you're doing something like a practicum evaluation, where you're evaluating somebody's therapeutic skills. This one. All right, so no, don't have sex with your students. Remember that whole multiple relationships thing? This is just kind of an underscoring all of that, or your supervisees. So it would feel a little icky if I were using the department as my own personal dating pool in whatever capacity I did that. Now, it's not just, don't just think it's just sexual relationships. I mean, there are other ways of the, remember that power dynamic, and there are other ways for that unequal balance of, relationships. But basically, we don't have sex with our students or our supervisees. That's just icky, horrible, and awful. So one question I had, though, is that basically you told stories about teachers dating former students before. Does APA have a time limit for how much time must pass first? No, it just sort of makes it sound like it's present tense. I'm going to go back to, though, what I said before. If you're going to start this, you need to remember that this relationship started on an unequal power dynamic. And this is also our ethical code. There's a difference between our ethical code and university policy and procedure. And that's where I talked about it, and it gets a little confusing because technically the university doesn't prohibit relationships between consenting adults. Our ethical code, though, says that this will be, a very dangerous path. And so realize that there may be a difference between those ethical standards we should hold ourselves to and what the policy is at the place where you work. But anyway, so there's not a definitive time limit. Like I told you, like with former patients, it was like 2 years, which is still super icky. This code really just kind of focuses more on current students, current supervisees. So technically, they make it sound like as soon as they graduate, yeah, again, there may be situations, but it also you got to make sure you're not taking advantage of somebody. You really do. So, multiple relationships being allowed. I'm going to go with no. This is still a multiple relationships, and so they're very clear about sex. But I would argue that, I was talking about house sitting, guys. I mean, so I think any time where someone may be unduly swayed because of that position of power, we have to not do that to put that person in that position. So it would go for no multiple relationships. It's dangerous, and you're going to end up possibly taking advantage of someone. And then the last one was, what if it's a romantic relationship with a family member of the student? There's nothing about that in the ethical code, but I am once again going to point to that just feels super icky, and Thanksgiving would be so freaking awkward. So, I guess think of it, give it the Thanksgiving test, right? Like, how icky is it going to feel at Thanksgiving? And if that doesn't do it for you, has it ever been a plot line on a Real Housewives of anything or an MTV show? And if it has, do you really want to potentially be in your own MTV Real Housewives of ickiness? All right, on that note, I'm going to stop.